this is the final day of the second COMy, the Second International Congress on Controversies in Multiple Myeloma, which was held in Paris between April 28th and 30th. I'm here with my co-chair, Professor Arnon Nagler from Tel Hashomer, and unfortunately the third co-chair of the meeting, Professor Facon, was not able to join us for the summary of this final day. So, Arnon, you feel relief now that...
I feel that we maybe contribute to the field of myeloma. I think it was very intensive 2 days. We were able to cover all aspects of myeloma, and not just in the Western world and in Europe, but also developing country. And I was very much impressed by the level of therapy that in Southeast Asia and the number of patients and the progress there that is really showing us that the improvement and progress that we have in myeloma is not just for a minority of the globus, but maybe all around.
Indeed, actually, you are alluding to our international multiple myeloma collaboration sessions that we had today with speakers from Japan, China, India, East and West speaking together. And like you, I was amazed with what's ongoing. I mean, the prospective trials that are being run by our Chinese colleagues, planning more than 2,000 patients in each trial. That was really impressive, and that further confirms to me that we are really in a sort of a United Nations against myeloma. I'm very, very pleased, and I think our meeting, this Congress, contributed tremendously to the education, to the dissemination of knowledge in the field of myeloma.
I fully agree. And another thing that we didn't mention before, but was the patient advocate meetings that we had in the beginning for, I guess, 2 days ago, with representative of France, Netherlands, Belgium, and UK. And I think that the patient angle, voice, is very important, now in every malignancies, but especially in myeloma. And I was very much impressed by the work that they are doing, the knowledge, the education, and I think this is another aspect that we had in this meeting, which is really impressive.
Absolutely, absolutely. I think this is a very unique feature that we managed to introduce in this meeting, and we're really very proud of it, this dedicated patient session, but also having a significant number of patients sitting in the room during the lectures asking questions. I was myself sitting several times next to patients, and it's fantastic because more and more, I think, we will win if we involve everybody, all stakeholders. And we know that our patients, their families, are really at the heart of our action, and we need them because they represent a very strong power in order to explain to the regulators, to the community, to the society in general, well, these are our needs, this is how it should go, and so on. I was really very pleased, but also I felt very emotional to see these, people struggling against a nasty disease, but really having a lot of hope.
I agree, and I think that these are the really hero of the field. We are physicians, we are doing our best, but to see this myeloma patients that considered to be devastating, lethal disease, when we no cure, and with disease-free survival, overall survival when we start many years ago of 3 years, now all of these patients, or many of them, are almost colleagues and sitting in the halls and living 7 or 10 years it's really the proof how much the field in myeloma has progressed in the last 10 years, I guess.
Yeah, so today, going back to what we discussed and what was addressed by the different distinguished speakers today, I thought now we are exploring new frontiers in myeloma, and the immunotherapy field is really impressive. So what are your thoughts about all what we heard, about all of these immune effectors, active immunotherapy, adoptive immunotherapy, pharmacologic immune modulation? You know, it's coming from all sides.
Yes, as we already discussed, I think that this is the future. And this is the future because this is target therapy. You know, as opposed to many other things that we are giving to the patient, this target the myeloma cells and have very nice toxicity profile, less side effects. And I think that, the field show already proof of principles of the effects of the monoclonal antibodies, and the effect of the checkpoint inhibitor, so release the immune system from its brakes or its natural brakes that can attack the myeloma. And I think these drugs and cellular therapies will move much forward, and we can say that in the future they will replace allogeneic transplantation, which is not fashion because of the toxicity and the fact not that there is no effect of the immune system against myeloma, but the toxicity is too high, and adoptive cellular therapy with engineered cells and with the monoclonal antibody, I guess will be the future in 10 years in combination of some of these novel agents.
Well, I don't know if it is 10 years. My hope that it's going to be even shorter, but we'll discuss this in some time, because the path of innovation is accelerating, my feeling, and things are moving very, very quickly these days. I mean, look, a couple of years ago, we were talking about these BiTE antibodies, about the CAR T cells. They are already in clinical trials, compassionate use. This is really very quick. And actually, I believe this is really good news.
So I tend to agree, but now when I prepared the talk about my talk today, I went over the publication in ASH. And in ASH, so the American Society of Hematology, just a few months ago in December, there are at least 15 publications about cellular therapy, CAR therapy, in animal models and in human, in patients with myeloma. And so I was amazed how much the field is really moving. I guess a bit more in the States than in Europe, but also in Europe. So I agree with you, maybe 10 years, it's
too long.
Too long, yeah.
Too long.
We need to be more optimistic.
Absolutely, because this disease cannot wait. So we need to get rid of it as soon as possible. And that makes me think, and I was really sensitive to something that was said by Dr. Berloghi, where he said that maybe we should, stop for some time and maybe do less trials with drugs, testing drug A, B, C, etc., and try to better understand the specific situations of given myeloma entities and so on. And I thought this was really important based on what we heard today about the definition of how to define high risk, ultra high risk, how to characterize the prognosis. We had this session about how to identify smoldering myeloma, high-risk smoldering, the aggressive MGUS, and so on. Do you think, how would you like to take it?
So I think that we heard not just from biology, which is one of the most important clinical investigator and contribute all of his life actually to improving the results in myeloma. I think that we heard from various investigators and Wazor Hervé and other about, and Sonnenfeld today, about mutation and the next generation sequencing and all the technology that we are available now and will be used to dissect the myeloma and to understand better the biology of the disease. And for sure, myeloma is not one group of patients, but will be various subgroup of patients, and I guess we will adapt the way we treat the patient, and maybe in few years it will be totally different than what we are doing today, which is somewhat mostly the same for all the patients with some modification, but in future I'm sure that subgroup of patients will get different therapy. Maybe someone will get less therapy, you know.
And some groups will be cured.
Yeah.
That's really the goal. So in summary, I would say we're very proud that a lot is being done in myeloma, but we need to be modest and humble. There is still a lot to be done yet. And until we find a cure, I think we will continue the fight. And I think our patient can count on the myeloma community to work hand in hand together against this disease and design the best treatments, the best approaches, the best curative approaches. And obviously, definitely, we will have another edition of COMy, and we will have plenty of other myeloma events where we will celebrate the novel findings, novel discoveries, novel results. Thank you very much, Arnon. That was absolutely amazing. Thank you.
Thank you.